Okay, so welcome back after a very long time. First of all, I want to tell you, I had a little bad time in the last 1 month. My health was a little below, but I got a lot of emails, messages, WhatsApps, Facebook messages about where are you, what's happening to you. So I want to thank you for all the love and affection you have towards me. So I want to talk to you today about an interesting remedy, Bacillinum. I like to call it as the lesser used nosol. Bacillinum Burnett, I like to call it, because Burnett was the person who actually started using this remedy. This remedy, and before I talk about Bacillinum, this book I want to tell you 50 Reasons for Being a Homeopath by Burnett is a book that is a must read for all of you. All the fans out there of homeopathy, all those people who really believe in homeopathy, who want to be fine homeopath, read up this small book of 50 pages, 100 pages by Burnett, where I want to tell you the story about this book where once one allopathic doctor asked Dr. Burnett, who was an allopathic doctor but later on he got converted into homeopathy. He asked the allopathic doctor asked Burnett, why are you practicing homeopathy? Give me one reason you're practicing homeopathy. Burnett that day decided, I'm going to give you 50 reasons why I practice homeopathy. And he wrote letter after letter after letter. He wrote 50 letters. And the book that you see here is a book made of all the 50 letters. It's phenomenal. So let's start with Bacillinum. Bacillinum is a nosode and it is formed from the lung of tuberculosis, first described by Burnett. And it's important that Bacillinum is actually where they took up some lesion of the tuberculoid lung, which include Bacillinum tuberculosis. It also include other bacteria, and then it was formed. So Bacillinum doesn't only contain tuberculous bacteria; it contains other atypical bacteria also. This is why Bacillinum is called as a broad spectrum tuberculin. They say the region sphere of action of Bacillinum is much bigger than tuberculin. Tuberculin is a remedy which is also worked on by Kent. That's why we call it tuberculinum Kent. And it is formed from the tuberculosis of the lung, especially the tubercular part. While Bacillinum contains both tuberculous and atypical. The main person who started working on Bacillinum is Burnett from London, Clark, and later on Dr. Sankaran, my guru, also did a lot of provings with it, which I'll talk to you about. But before we start about Bacillinum, I want to tell you, Bacillinum is used very, very unhomeopathic way, and still we get good results with Bacillinum. But what if we know it artistically, medically, scientifically, to know it, how to use it in a better way? So that's my idea. I want to give you a picture of Bacillinum. The main idea of Bacillinum, main genius of Bacillinum, is hectic pace, changeability, theme of suffocation, deformed dwarfed structure, chronic cough cold, offensiveness of pathology, and a tubercular miasma. So let's start with Bacillinum. We'll start studying from the main book, Boric. One of the main things about Bacillinum is a lot of lung pus, infection, wheezing, rattling. One of the main things is that patient is not able to expectorate that much. I often use Bacillinum when antimony tart and arsenic fails. The other very important thing where Bacillinum is used is in eczema around the eyes and in ringworms. There is also a very well-known bacillinum for tuberculosis of the abdominal glands. Clinically, whenever you see in the lung lot of wheezing and in the X-ray lot of congestion, and you see in the blood test a lot of polybacillary reports, you see different bacteria. Even if it is not tuberculosis, think about the first remedy, Bacillinum. Dr. Sankar, my guru, he did a proving few years back on Bacillinum. And the main thing he found out, the main state of Bacillinum is hectic. I have to do so many things. My life is hectic. I want to do this, I want to do that, I want to do this, I want to do that. This is a hectic pace. The idea that time is less, I have to do more. Time is less, I have to do more. You also see the idea of suffocation there. Hectic, fast. This is the pace. Let's study a little bit. Especially, I'll go step by step. First, we will do the physicals and then we'll understand the mental aspect. Especially in cases of recurrent colds. Top remedy. Especially when patients say, I get cold and cough, especially coryza, as soon as I get up in the morning. Coryza morning rising, bacillinum. After taking cold, chronic, greenish, like Kalibai. Lot of tooth pain. Very important. Toothache, caries, tartar teeth, serrated teeth, yellow teeth. If you see patients with yellow teeth, yellow, close your eyes, start with bacillinum. Lot of recurrent throat infection. Remember, bacillinum is not for acute infection. It is for recurrent. We are trying to remove the disease from the root. So when you see a recurrent thing, remember. Even in bad cases of asthma, when arsenic has failed, you can see the totality. Patient cannot lie down, has to sit up, rattling, wheezing at night. And we are thinking arsenic. The main remedy is bacillinum. Also in cases of dysmenorrhea, in infertility, in miscarriages, I am using bacillinum. But the best thing I've used is in coughs, bad cough, dry cough, very spasmodic dry cough from the larynx in the sleep. Remember bacillinum. One very typical keynote. I check the palms. If the patient palms are sticky, cold, perspiration, more sticky, more perspiration than silica, think about bacillinum. Warts. History of lot of warts, think about bacillinum. Some more very important things I want to tell you. All the symptoms of bacillinum are aggravated after they get up in the morning. Finally, I want to tell you how to pick up bacillinum by just looking at the patient. First of all, shiny nails. Very shiny, they will shine. Number two, very hairy back. Even females, even males, even children with a lot of hair in the back. Remember, bacillinum. I told you about yellow teeth. Recurrent ringworm. Not once, recurrent. History of tuberculosis. Finally, snappishness. Patient will speak in a very uncivil way. क्या है क्या करना है this is the way they will speak. Three things I want to tell you more. My guru Dr. Sarkar would use in bladder cancer Bacillinum 1N. His guru Dr. B.N. Chakraborty from Kolkata would use in cancer of lung cancer and sarcoidosis Bacillinum 10M. And in cases of cerebral palsy with stunted growth, low understanding, Bacillinum 10M. Relationship of remedies. Bacillinum is known to be complementary to Kalikam and Calcarea Phos. The other very important thing I want to tell you today about Bacillinum, very interesting, that Bacillinum, if you study, they can often be very snappish. And They don't want to answer your questions. One of the main thing is they constantly want to change. Constantly want change. I don't want this. In fact, there is a rubric. Constant desire for change of doctors. So if you see a patient who's constantly changing doctors, think about it. That's right. And with that, they'll be very critical. They'll be very complaining. There is a rubric, complaining bitter bacilli. Very important. And constant feeling something wrong has happened to me. Wrong suffer. I want to tell you, very important thing here. Number one, they get dreams that they are running. Exhaustion, hectic. This is very important for basketball. And second, they get a dream that they are tired. They have done so much. They're tired, and they just don't want to meet a doctor. Doctor aversion is very important. Along with fear of dog, which is a tubercular magic feature, they have especially fear of black dog. Remember, this is what I want to tell you. Even in psychiatric cases, they will come across light tubercular and they will start hitting their head, striking head, and they will tear their head. So it's a very interesting remedy. So I want to encourage you. I want to encourage you in using this repertory more and more, this remedy more and more. This is my email ID. You can write to me and tell me what you learned. And stay tuned for more of my lectures. Thank you.